Pandemic? What pandemic?
What do you see when you look at that bar?
Obviously, they're definitely not social distancing and not wearing masks, but those are my friends over there. If they have coronavirus, I have coronavirus.
This is the next state to host a presidential rally, Arizona, a growing COVID-19 hotspot and home to a fight over masks. Look up and down the street and the impact of the virus is everywhere. Some businesses still shut down. Bright signs warn to socially distance. One bar worker in a mask, but many of these Tempe, Arizona residents?
It's just going to continue to get worse here until we do something about it.
You're not wearing a mask, though?
No, I'm not wearing a mask. I think the masks are good, but I think they kind of act as a placebo to some extent. I have a family personally who's been lost to coronavirus, so like I should be wearing a mask, but I don't. Not one of my friends, you know.
It angers me, and I'm trying to be calm for this interview and for the camera.
Dr. Mortaza Akhtar is an emergency room doctor in Phoenix, where he's seeing a dramatic increase in COVID patients, just like the rest of the state. This is what's happened to cases in Arizona since March. The number of new cases continues to break records nearly every day this week. Arizona was among the first states to reopen. Businesses back. The gatherings followed, like the protests of police brutality. And masks in public, as we saw in Tempe, not always used.
To tell the whole world that basically I'm a social Darwinist, if you die, I don't care, I just want my beer and burger, is really, I mean, even kindergartners have more empathy for other people. It's really upsetting.
Dr. Akhtar is one of more than 3,000 doctors and nurses to sign this letter. The goal, to get Arizona's governor to issue a statewide mandate requiring masks, writing, "Please stand up and help educate, as well as protect those who do not understand the importance of masks." Doug Ducey instead says he will leave those policies to each mayor.
The governor of our state is saying, I'm going to let the mayors decide. I mean, the mayors could potentially say, I'm going to let the neighborhoods decide. And as you can imagine, that breaks down pretty quickly.
So ineffective.
Not as effective as it could be.
Publicly, Governor Ducey has shifted. Last week at his weekly news conference, he carried his mask in his pocket. This week, he arrived wearing it. As Ducey prepares his state to host the perpetually maskless president on Tuesday for a rally at an indoor megachurch, the governor says the White House protocol will call for masks. Ducey stressed the 3,500 capacity event should go on.
We're going to protect people's rights to assemble in an election year.
There are fears already about a second wave in the fall of the COVID pandemic, and it now has the government replenishing the strategic national stockpile. CNN's Leila Santiago joins us now with more. What exactly goes into that stockpile?
Well, we know what the health officials are trying to get to. We don't know exactly what's in that stockpile right now. And Jim and Poppy, important to note, this comes at a time where we're really hearing conflicting messages come from the administration. One advisor saying there will be no second wave. Another one saying, yeah, we're working to replenish in preparation for what could be a second wave. So important to note at what HHS officials are looking at here. They're trying to accomplish three things. They don't want to depend so much on foreign supply. They want to take an insight on the supply chain and private and public partnerships. And they also want to make sure they have the right breadth of products. So what does that mean? Well, they're looking at the worst 30 days from the last 5 months and multiplying that by 3 to get a 90-day supply. And they're hoping to do that by late October. This information coming from a health official with Health and Human Services. And so the concern is what happens if before late October we start to see that resurgence, that second wave that so many people are concerned about. And what we're seeing, as I've spoken to a lot of state officials, is that they're not waiting on the strategic national stockpile. They're saying, look, we're going to establish our own state stockpile for the first time so that if this comes, we can be prepared.
Let's compare new cases, Doctor. New cases in the U.S., Canada, Italy, and Germany. All but the U.S. are trending way down. In fact, the U.S. is actually trending up. It's like we've given up.
Well, I don't think we've given up, but there are large cultural differences. These other countries have a great social consciousness. Here, we're more individualistic. That's our whole tradition. And there are all kinds of people who just want to go out there and say, I want to be me. This is what I want to do. I'm tired of this cabin fever. It's very difficult to persuade everyone really to wear those masks and to behave in a prudent fashion. So I think that's at the crux.
I mean, I think individualistic or individualism is one thing, but ignoring facts or not believing in facts and science, that's another thing, Doctor. Places that struggled early on, like many states in the Northeast, are now doing better, while states that didn't have many cases in the beginning are now seeing surges, particularly in the South and in the West. Why are we seeing this flip-flop?
Well, I think there was in addition to what we've just said, I think there was this hope that COVID would go on a summer vacation. And that was really anticipated. I heard that much discussed in my neck of the woods, and it's just not happening. COVID's not going away. It's with us and will be with us, I'm afraid. This is the uncomfortable but real new future.
This afternoon, the nation's top infectious disease expert, Dr. Anthony Fauci, said that he is concerned about what he called a disturbing surge in coronavirus infections in some states, calling it very troublesome, and that the next 2 weeks are critical in order to get the spread under control. The number of new coronavirus cases is on the rise in half of all states, and 13 states just yesterday saw a record number of new infections. Despite the spread, the Trump administration is, as of now, continuing its plan to end funding for testing sites a week from today. Even in hard-hit states such as Texas, Colorado, and Illinois, 13 sites across 5 states in total, even though Dr. Fauci once again emphasized today the importance of testing.